these are some things that are mandatory if you're raising goats in case of emergency. First thing is gauze and vet wrap and blood stop powder for obvious accidents, things like that. If your animal's bleeding, you want to get a bandage on them anyway, but if you have to, if it's bleeding really bad, you can wrap this really tight, do a really tight pressure bandage for a few minutes, and then 10 or 15, and then take it off and see what it looks like. Of course, as you're on the way to the vet, if it's bleeding that bad. But that can just be something that could mean your goat doesn't bleed out before you get to the vet. Next is thiamine, or if you don't have thiamine, at least have vitamin B. Vitamin B complex, because we need the thiamine in it. This is in case of polio, and this could mean life or death in a matter of half an hour, maybe a few minutes even, depending on when you catch it. So you always want to have either of these on hand, preferably the thiamine, but the complex will work. You'll just have to give higher doses because it doesn't have as much thiamine per ml as straight thiamine. These come in different strengths. This one's 500 milligrams per ml. Last one I got was 200. It doesn't really matter. You can't overdose on thiamine, so just get whichever strength you want. Another one is needles and syringes, obviously for administering the thiamine. And the other one is a really big gauge. This is 16. A really big gauge needle, or even a trocar. And what you might want this for is if your goat has really bad bloat, you can puncture the stomach. And you'd have to know what you're doing, talk to your vet and figure it out, but in case of emergency you can do that if they're extremely bloated. And a needle will work, although obviously the hole is really small. Trocar would be better, but you can use a needle. One thing I forgot because it was in the fridge is C&D Antitoxin. You should always have a big bottle of this on hand, because if you have a feed room raid and everyone's getting sick, you can give them huge doses of this, 20 mLs every few hours, and that can help with the enterotoxemia that might set in. I always have this on hand, and the bad thing is it goes bad as soon as it's used. They want you to use it all at once. It grows mold on the top if you don't. But even so, you should always have a big bottle on hand, because if you do have something get sick, they're going to need a lot of it. Other things that are optional but greatly recommended are an antibiotic, or 2 or 3. I have Penicillin, which isn't here, but then LA200 and Naxel too. These are just handy if your goat gets sick on a weekend and it needs antibiotics before Monday. You better have something on hand, or else you're having a big vet bill. So these are 2, and then I also have Penicillin, but that's in the fridge. And Banamine is another one, also if your animal gets sick on the weekend and needs some Banamine. Banamine is a little more optional, unless you're using it for brain swelling. If you're using it for brain swelling, then yes, you should always have Banamine on hand. But as far as just pain control, Banamine isn't a mandatory drug, because animals can live with pain. Just makes them feel a little better. Maybe get their appetite up if they're not feeling so bad. But if your goat does have polio, I should put this up here, because if your goat does have polio and they're having brain swelling from that, you want to give Banamine or dexamethasone. You can do either. So these are just a few things I always recommend that you have on hand if you're raising goats.